Hello everyone, welcome back to Mid Baby YouTube channel. Today's video is about a psychiatric condition called hoarding disorder. So in this video we'll talk about all about hoarding disorder, the etiology, the comorbidities, the differential diagnosis, the epidemiology, the cause and prognosis of this condition, and finally the treatment of this condition. So let's get started. I would start explaining about hoarding disorder with a clinical condition in order for better understanding of what is this condition. So it's about Miss T, a 55-year-old single woman presented to a therapist accompanied by her adult son, who expressed concern about Miss T's inability to throw things away. He reported that Miss T's home was extremely cluttered with needless things. Whenever he attempted to help her or organize things, however, Miss T would become agitated and argumentative. Miss T confirmed her son's complaint and reported having this difficulty for as long as she could remember, but never really viewed it as a problem. Over the past 5 years, Miss T's home had become increasingly cluttered to the point that it became more and more difficult to move around within it. She was able to keep the kitchen and bathroom relatively clutter free, but the rest of her home was filled with boxes and bags filled with papers, magazines, clothes, and miscellaneous gifts and trinkets. Her living room was the most affected. Her son reported no longer being able to visit his mother because it was so difficult to move around and there were very few places for them to sit comfortably. This, Misty admits, has been a major source of depression for her. Misty used to enjoy entertaining family and friends, especially on holidays, but has not had any guests over in years because she felt that her home was no longer suitable for company. She had made a few attempts to clean out her home, but was unable to discard most items. When asked why she was keeping them, she replied, "I may need them later." So this is a clinical case about a 55-year-old single woman. So she is facing problems with throwing things away, which are needless things. And when someone throws those things, she becomes very agitated and argumentative. So because of these behavior of her house become clutter and there is very little space for people to come in, and that's why she had problems with the social interactions, and that were a source of depression for her. And she had made attempts to clean her home, but still she is unable to discard many of the items in the home, and she thinks that those items may be of need for her later on, and that's why she is unable to discard all those items. So is this a normal thing, or is it okay to have such kind of behavior? Of course not. It is a problem and it is a psychiatric condition, and this is called a hoarding disorder, which is a separate psychiatric condition. And in this video we'll talk all about hoarding disorder. So let's get started. Hoarding disorder. A compulsive hoarding is a common and often disabling phenomenon associated with impairment in such functions as eating, sleeping, and grooming. Hoarding may result in health problems and poor sanitation, particularly when hoarding of animals is involved, and may lead to death from fire or falling. The disorder is characterized by acquiring and not discarding things that are deemed to be of little or no value, resulting in excessive clutter of living spaces. Hoarding was originally considered a subtype of obsessive compulsive disorder (OCD), but now it is considered to be a separate diagnostic entity as hoarding disorder. It is commonly driven by an obsessive fear of losing important items that the person believes may be of use at some point in future, by distorted beliefs about the importance of possessions, and by an extreme emotional attachment to possessions. So the epidemiology of hoarding is believed to occur in approximately 2 to 5% of the population, although some studies have found lifetime prevalence as high as 14%. It occurs equally among men and women and is more common in single persons and is associated with social anxiety, withdrawal, and dependent personality traits. Hoarding usually begins in early adolescence and persists throughout the lifespan. The most significant comorbidity is found between the hoarding disorder and the OCD, with as many as 30% of OCD patients showing this hoarding behavior. Studies have found an association between the hoarding and also compulsive buying. Approximately half of compulsive buyers display a high level of hoarding. However, up to 20% of hoarders do not show signs of excessive buying. Hoarding is associated with high rates of personality disorders in addition to OCD, and these include the dependent, avoidant, schizotypal, and paranoid types of personality disorders. Deficits in attention and executive function that occur in hoarding may resemble those seen in attention deficit hyperactivity disorder, ADHD. The OCD patients with hoarding symptoms had a 10 times higher rate of developing ADHD than those without it. Hoarding behaviors are relatively common among schizophrenic patients and have been noted in dementia and other neurocognitive disorders. Other disorders associated with hoarding include the eating disorders, depression, anxiety disorders, substance use disorders, which particularly alcohol dependence, kleptomania, and compulsive gambling. Among anxiety disorders, hoarding is most associated with the generalized anxiety disorder 27% and social anxiety disorder 14%. The etiology. The little is known about the etiology of hoarding disorder. Research has shown a familial aspect to hoarding disorder, with about 80% of hoarders reporting at least one first degree relative with hoarding behavior. Biological research has shown a lower metabolism in the posterior cingulate cortex and the occipital cortex of the hoarders, which may also account for various cognitive impairments within hoarders such as attention and decision-making deficits. Diagnosis. Hoarding disorder is characterized by, firstly, the acquiring of and failure to discard a large amount of possessions that are deemed useless or of little value. Secondly, greatly cluttered living areas precluding the normal activities. And thirdly, the significant distress and impairment in functioning due to hoarding. The fifth edition of DSM-5, which is Diagnostic and Statistical Manual of Mental Disorder, includes diagnostic specifiers that relate to insight, which may be rated poor, fair, or good. Some patients are completely unaware of the full extent of the problem and totally resistant to the treatment. At times, delusional beliefs about hoarded items are present. The clinical features. Most hoarders do not perceive their behavior to be a problem. In fact, many perceive their behavior to be a reasonable and part of their identity, and that is the biggest problem in hoarding disorder. These people doesn't find their behavior to be a problem, and they are okay with those conditions. That's why they do not ask for treatment, or in fact they are resistant to treatment. Most hoarding patients accumulate possessions passively rather than intentionally, thus, clutter accumulates gradually over time. Common hoarded items include the newspapers, mail, magazines, old clothes, bags, books, lists, and notes. Hoarding poses risk to not only the patient but also to those around them. Clutter accumulated from hoarding has been attributed to deaths from fire or patients being crushed by their own possessions. It can also attract pest infestations that can pose a health risk both to the patient and residents around them. Many sufferers have been evicted from their home or threatened with eviction as a result of their hoarding. In several cases, hoarding can interfere with work, the social interaction, as with our patient in the clinical case, and the basic activities such as eating or sleeping. The pathological nature of hoarding comes from the inability to organize possessions and keep them organized. Many hoarders avoid making decisions about discarding items. Patients with hoarding disorder also overemphasize the importance of recalling information and possessions. For example, a hoarder will keep old newspapers and magazines because they believe that if discarded, the information will be forgotten and will never be retrieved again. In addition, patients believe that forgetting information will lead to serious consequences and prefer to keep possessions inside so as not to forget them. The differential diagnosis. The diagnosis of hoarding disorder should not be made if the excessive acquisition and inability to discard possessions is better accounted for by another medical or psychiatric condition. Until recently, hoarding was considered to be a symptom of OCD and obsessive compulsive personality disorder. But however, there are some other major differences. Hoarding disorder patients do not display some of the classic symptoms of OCD, such as recurring intrusive thoughts or compulsive rituals. Unlike symptoms of OCD, symptoms of hoarding worsen with time. Rituals are not fixed, and obsessions about dirt or contamination are absent. OCD patients have better insight into their condition. Symptoms are usually ego dystonic, whereas in hoarding disorder, they are ego syntonic. It means that in OCD patients, ego dystonic, it means like they themselves knew that their actions are not good and they wanted to stop those actions, but have they cannot resist to those actions. That is why it is called ego dystonic. They are not happy about those actions. Whereas in hoarding disorder, it is ego syntonic. It means that they don't find their behavior to be problematic, and it doesn't affect them in that way, and like they don't find them as a problem, so their actions are ego syntonic, and that is a major problem, and that's why they don't go for a treatment, and in fact they don't find a motivation to treat it, and they are treatment resistant. Hoarding behavior is seldom repetitive and is not viewed as intrusive or distressing to the hoarder. Distress mainly comes at the prospect of discarding items, and it manifests more as guilt and anger than anxiety. Hoarding disorder also tends to be less responsive to the classic treatments for OCD, such as the exposure therapy, the cognitive behavioral therapy, and the selective serotonin reuptake inhibitors, SSRIs. Some case reports show the onset of this behavior in patients after suffering brain lesions. Hoarding associated with brain lesions is more purposeless than hoarding that is motivated by emotional attachment or high intrinsic value of possessions. Hoarding behavior can be associated with schizophrenia. It is mostly associated with severe cases and is seen as a repetitive behavior associated with delusions, self neglect, and squalor. Bipolar disorder is ruled out by the absence of severe mood swings. The cause and prognosis. The disorder is a chronic condition and with a treatment resistant cause. Treatment seeking does not usually occur until patients are in their 40s or 50s, even if the hoarding began during adolescence. Symptoms may fluctuate throughout the course of the disorder, but full remission is rare. Patients have very little insight into their behavior and usually seek treatment under pressure from others. Some patients begin hoarding in response to a stressful event, while others report a slow and steady progression throughout life. Those who report onset due to a stressful event have a later age of onset than those who do not. Those with an earlier age of onset run a longer and a more chronic course. So, the treatment. Hoarding disorder is difficult to treat, although it shows similarities to OCD. Effective treatments for OCD have shown little benefit for patients with hoarding disorder. In one study, only 18% of patients responded to medication and the CBT. The challenges posed by hoarding patients to typical CBT treatment include the poor insight to the behavior and low motivation and resistance to treatment. The most effective treatment for the disorder is a cognitive behavioral model that includes training in decision making and categorizing, exposure and habituation to discarding, and cognitive restructuring. This includes both office and in home sections. The role of the therapist in this model is to assist in the development of decision making skills, to provide feedback about normal saving behavior, and to identify and challenge the patient's erroneous beliefs about possessions. So, the goal in treatment is to get rid of a significant amount of possessions, thereby making the living space livable, and to provide the patient with the skills to maintain a positive balance between the amount of possessions and the livable space. The pharmacological treatment studies using SSRIs have shown a mixed results. So, that's all about hoarding disorder. I hope this video is useful. I have tried to include everything about hoarding disorder and to a greater understanding of this psychiatric condition. Thank you for listening. Please like, share, and subscribe. Thank you.